you. We got those answers last night. We haven't had time to, I haven't had time to go through them fully. I do know there's still some outstanding questions, and we will probably have some follow-up. That being said, President Biden recently announced that he will direct states to make every American adult eligible for COVID-19 vaccines by May 1. This is exciting. However, eligibility is very different than accessibility and shots in the arm. What is the administration's projection for when every American adult who wishes to be vaccinated will be able to be fully vaccinated?
Thank you so much for that question. There are numerous resource constraints that have been a challenge with regard to rolling out vaccines. So among them has been resource money itself, but also the vaccine itself. We know now that we will have adequate supply of vaccine for every American who is interested by the end of May, which I think is a really critical, important resource to know that we have. But that's not the only resource we need. We need to have actually vaccinators. We need to have places where people can get vaccinated, and we need to have people who want to roll up their sleeves to get vaccinated. So that is a work that we have ahead. The people who've rolled up their sleeves for the 110 million doses that have already been given are people who are anxious to get vaccinated, but we have a lot more work to do in terms of distribution.
So you would say sometime in June probably, because if there's plenty of supply by May 31st, then probably everybody should be able to get it in May or early June. Is that a fair statement?
I'd be reluctant to put a date on exactly when we will have enough of the vaccinators and vaccinated.
Let me move on because I got limited time, and I know you do too. Dr. Fauci and Dr. Marks, recent reports have indicated a rift has developed between countries, particularly some in the EU, but other countries as well, which have approved the use of the AstraZeneca vaccine. And they're seeking additional doses. The Biden administration, in the meantime, has been stockpiling doses of the AstraZeneca vaccine, waiting for the emergency use authorization from the FDA in the United States. Now, I'm not going to fuss with the FDA because they got to make that decision. That's their job. But I am curious about, how old is the AstraZeneca stockpile now, and when does it expire? I know it has a 6-month life, so how old is it, and when are we going to run into the risk of actually throwing some vaccines away that if we don't want to use them, somebody else might want to? Dr. Fauci, do you want to start with that? And then Dr. Marks, anything you want to add?
Yeah, let me just, Congressman Griffith, address the issue of the AZ and the issue in Europe. Right now there's a big conflict in Europe where many of the countries do not want to use the AZ vaccine. We have a situation where the European Medicines Agency, the EMA, has indicated very, very clearly that they feel that this is not an issue with regard to the supposed adverse events of blood clotting. So they feel that it should be used, even though many of the countries are not using them. We in the United States have an ongoing trial that's fully enrolled with the AZ product. And as you mentioned correctly, within a reasonable period of time, as we get into April, there would likely be enough data to be able to make a determination as to regard to the EUA. With regard to the expiration, I would have to refer that to Dr. Marks because the FDA knows more about that than I do.
All right, and since you brought up the blood clotting, before you get there, Dr. Marks, I did some math, and somebody correct me if I'm wrong. In the UK, they've given out 17 million doses of the AZ and had, according to my math, 0.002% folks with blood clotting issues and having had coronavirus and then had blood clotting without having taken any vaccine. Is that unusual?
Yeah, I think
to me that's an unusual amount.
Yeah, I think that's the point, Congressman Griffith, that the European Medicines Agency is making, that the actual incidence of the clotting is not more than you would expect in the population in the absence of vaccine. So that's why they're insisting that the concern is not founded on the reality of what's gone on.
My time is almost up. Dr. Marks, can you tell me what are we doing with this stockpile, and is it going to go bad, and are we going to throw away doses that could be used for countries that do want the vaccine, even whether it be the EU or other nations?
So the EU, when they approve this, put an expiration date, but we do not necessarily have expiration dates on products under investigational drug applications when they are maintained on stability studies. And so I do not believe at this time we are at risk of throwing that vaccine out anytime in the near future.
But you do hope that we'll get approval soon, or you hope that if it works out and the FDA is appropriately approves it, that we would have those vaccines for Americans then.
That's correct.
All right. Thank you very much. I yield back. Thank you, Madam Chair.
I thank the gentleman. Chair now recognizes herself for 5 minutes.